Hi everyone, I am Dr. Anita. I am a consultant microbiologist. So today I am here to discuss about non-sporing anaerobes. So in this session, I'll be talking about introduction of anaerobes and also classification, that is sporing and non-sporing anaerobes, and also clinical presentations, that is infection caused by anaerobes, non-sporing anaerobes, and also about lab diagnosis of the infections caused by non-sporing anaerobes, and a few note about treatment aspects. So moving on to the introduction. So anaerobes, as we all know, that do not have a cytochrome system, and that's why do not neutralize toxic oxygen metabolites. These are like the anaerobes can be obligate anaerobes or aerotolerant anaerobes. That is, obligate anaerobes are nothing but this cannot grow in the presence of oxygen, whereas aerotolerant anaerobes, or these can tolerate the presence of oxygen but do not utilize oxygen. So that is the difference between obligate anaerobes and aerotolerant anaerobes. And anaerobes need special requirements to grow in culture, such as anaerobic condition, and it can be either in Macintosh Phil's anaerobic jar, gas pack system, anaerobes system, anaerobic glove box workstation, and pre-reduced anaerobically sterilized media. Okay, so the obligate anaerobes cannot grow in the presence of oxygen, so it needs a strict anaerobic condition, which can be achieved by any of this method, like Macintosh anaerobic jar, or gas pack system, or anaerobes system, or Pras media. Okay, whereas aerotolerant anaerobes, this can tolerate the presence of oxygen, but it does not utilize the oxygen. So, and also medium with low redox potential, this can be achieved by adding to the medium with reducing substances such as unsaturated fatty acid, ascorbic acid, glutathione, cysteine, glucose, sulfites, and metallic ion. So, obligate anaerobes can be grouped into spore-bearing anaerobes and non-spore-bearing anaerobes. The examples of spore-bearing anaerobes includes Clostridium species, and then for non-sporing anaerobes, let us see in the forthcoming slides. So, non-sporing anaerobic infections. So, medically important non-sporing anaerobes, this can be classified into gram-positive and gram-negative groups. So, beside the list, there are several other anaerobes that occur in soil and water and may be of industrial and agricultural importance. So, okay, there are several anaerobic bacteria that can occur, that occurs in soil and water. So, this is a table showing gram-positive and gram-negative anaerobic cocci. Here you can see as a gram-positive cocci includes Peptostreptococcus and Peptococcus, whereas gram-negative cocci is Veillonella. Whereas gram-positive bacilli includes the following, that is Bifidobacterium, Eubacterium, Propionibacterium, Lactobacillus, Actinomyces, Mobilenchus. Whereas gram-negative bacilli, anaerobic bacilli, this includes bacteroids, Prevotella, Porphyromonas, Fusobacterium, Leptotrichia, Spirochetes, Treponema, and Borrelia. Okay, this is about non-sporing anaerobic bacteria. So, you can classify as gram-positive cocci, gram-negative cocci, gram-positive bacilli, and gram-negative bacilli. So, anaerobes is normal flora. Usually, non-sporing anaerobes are often a part of normal flora of oral cavity, GIT, skin, and genital tract. And common examples include in oral cavity, the most common commensals are anaerobic cocci, actinomyces, fusobacterium, bifidobacterium, prevotella, and spirochetes. In stomach, lactobacillus. Okay. In intestine, anaerobic cocci and bacteroids fragilis, which is common, and fusobacterium, bifidobacterium, and prevotella. In vagina, again anaerobic cocci, lactobacillus, prevotella, bifidobacterium. In skin,